Welcome to Pediatrics tutorial. In today's session, we are going to discuss one of the topics in pediatrics displayed by the slide here. As you can see, when you look at this slide, what have you observed? You can see that the child is looking healthy. The child is looking nutritious food. Okay, the child is in a comfortable environment. So basically, in this session, we are going to concentrate on specifically everything that favors the child. Okay, looking at the condition of the child, the health of the child, how the child is eating, is the child growing or not. Okay, so allow me to introduce you to the topic known as the well child. Just like previously depicted picture, you could tell that the child is looking healthy, eating nice food in a favorable environment. So now, in pediatrics, we discuss the well child, and under the well child, we looking at who is the well child, and from there, we are under well child. We are going to look at growth and development. What differentiates growth from development? What are some of the differences or some of the comparisons between growth and development? From there, we are going to look at factors that affect growth and development of the child, because it's very much important in pediatrics to look at the well child. Everything that is favoring the condition of the child, everything that is bringing problems to the health of the child need to be ruled out. Therefore, we are going to start with the definition of the well child. Who is a well child? That's the first question you should ask yourself. Who is the well child? What do we mean a well child? Okay, so basically when you look at the well child, we are not solely going to just depend on whether the child is not injured, or maybe whether the child has eaten, or maybe whether the child is in a clean environment. The well child, we are going to take this child holistically. Okay, the holistic approach, I mean, we want to look at all parameters that can affect the child. We want to assess everything around the child. If every parameter is in well accord, then we can describe that particular child to say that the child is well. Now let's define who is a well child. So a well child is a child who is physically, mentally, emotionally, and socially healthy, and whose growth and development are appropriate for age, with no signs of disease or disability. Have you gotten who is the well child? We are not just looking at the physical part of the child. We are not just looking at the mental part of the child. We are not looking at just emotional part of the child, but we are also considering all other factors around the child. Okay, if you look at the point which is saying whose growth and development are appropriate for the age, is the child body or growth and development appropriate to the age? Okay, is the child able to sit at 6 months? That's what we mean. Is the child able to walk at 1 year? Okay, that's what we mean. So there are some of the examples on growth and development. And with no signs of disease or disability. That is considered to be the well child. Now that we've looked at who the well child is, we want to look specifically at which parameters, which sentences, or in what perspective is a well child, because that one we described to be a well child, the definition of a well child. Now we want to look at some noted parameters that define the well child. Who is a well child? A well child has normal growth parameters, weight, height, and head circumference. These things should be normal. What do we mean by normal? Appropriate for the age. Okay. So if the child's weight is corresponding to their age, then that particular child has normal growth parameters. If the height is corresponding to their age, not only looking at, of course, we should also note that some people are just short genetically, but some age can tell correlating with the height. Okay. Apart from that, who is also a well child? A well child, we are looking at a child who achieved developmental milestones at the expected age. Okay? So, a well child, we are looking at all developmental milestones. When we look at developmental milestones, things like sitting, growing, speaking, standing, walking, running, all these things, these are what we call developmental milestones. So, is the child able to sit at 6 months, at 7 months? Is the child able to stand and or walk maybe by the ages of 1 year? Okay, some children even walk with 10 months, 1 year. Is the child able to walk? Is the child able to talk or make some words at the age of their 2? Okay, is the child able to make meaningful sentences at the age of 3? Okay, all those things that we want to look at, have they achieved their developmental milestones at the expected age? Then it means that they are well if they have achieved everything. Now look at a situation where someone is 5 years old and they can only sit. Then that particular child does not achieve their development milestones at the expected age. What is the other parameter? Is the child free from illness or has minor self-limiting conditions? Okay. If the child is free from illness, of course, there are some endemic diseases which are around. They are all over. For as long as they can get sick and receive their treatment within a short period of time. But we are not talking about someone being ill for a longer period of time. Okay? Or maybe have they having any minor self-limiting conditions? Okay? There are some things or maybe disabilities that the child might have in case where they are unable to hear, they are unable to talk. You cannot describe that to be a well child. The other point is receiving appropriate nutrition, immunization, and health care. Appropriate nutrition is very much important for growth and development of the child. Brain development depends on the kind of food the child is eating. Immunization, there are a lot of conditions. You find that we have tuberculosis, we have poliomyelitis, we have tetanus, we have diphtheria, we have Haemophilus influenza type B, we have hepatitis B. All these conditions, is the child fully immunized to these conditions? Is the child fully immunized? Have they received the vaccines at their appropriate age? For each and every child, they need to receive all their vaccines before they celebrate their second birthday. Okay, that is how the immunization schedule for Zambia is being set. Okay, is the child receiving the health care? Health care, things like advice on nutrition and even anthropometry, getting their weight, length, everything, so that they determine if the child is getting really well. Is the child, the other point, fifth one is saying, lives in a supportive family and safe environment. If the child is living in a supportive family and safe environment. Okay? So if the child is not living in a supportive environment, let's say there is physical abuse of the child, okay? The environment is dirty, where the child can easily be harmed or maybe get easily infections after infections that will make them being ill for a long period of time. So that's basically give more emphasis about who is a well child. Now that we've looked at who is a well child, the definition of who is a well child, and then looking at parameters which makes a well child, let's go ahead and look at the roles of a nurse in a well child. What are some of the roles of the nurse in the well child? What are some of the roles of the nurse in the well child? What have you seen in this picture? As you can see, a nurse here. The mother is carrying the baby here. In the next picture, in the slide, you can see here the nurse measuring the weight, the height of the child. Okay, so now let's look at these parameters which are denoting to the roles of a nurse in the well child. What are the roles of a nurse in the well child? Number one statement is to promote normal growth and development. Promoting normal growth and development. So how can a nurse promote normal growth and development? As you can see here, the nurse is doing health promotion, talking to the mother concerning the health of the child. Now, we are looking at normal growth and development. If the mother comes with the child to the health facility and you as a nurse, you see that the child is not growing so well, or maybe the child looks malnutrition, at that particular time, you can measure the weight, like this one, measuring the weight, to see or detect any deviation from normal, detecting abnormal from normal. Okay, so at that particular time, if there is any problem detected, you need to intervene. But at that particular time, you are promoting normal growth and development through measurement, counseling of the mother, and among many other things. How about the other point? Early detection of deviations from normal. Just like in the slide I was showing you, you can actually measure the height of the child and calculate their BMI. Okay, you measure the height and the weight of the child to calculate BMI. It's going to give you the body mass index. You can tell if the child is obese or if the child is not growing so well. In case of this one, you can even measure the mid to upper arm circumference, the mark. You get the mark and determine if the child is really nutritious or not. Is he getting nutritious food or not? Okay, so that one you detect the deviations from normal. And how about the other one? Health education of parents and caregivers. Health education, as you can see here, even I've put health promotion. You can see that the mother, the nurse here is trying to put something in the mother on how to take care of the baby. If the baby is too little and the mother doesn't know how to breastfeed, you teach them how to breastfeed. Okay, use of uh, cup and spoon, all those methods to make sure that the child is receiving adequate nutrition. So that one was on health education and parents and caregiver. Health education can come in different forms. Maybe it could be that you want to teach them on a drug adherence, among others. Okay. And apart from that, we also have disease prevention and health promotion. So as you can see here on this picture, or slide rather, you can realize that there are a lot of things that can be done in this particular way. You can do health education and health promotion here. Okay? Health promotion looks at getting some information from the mother, maybe let's say on their social history and environmental history, where they throw the rubbish, where they fetch water, among other things. Once you ask there, depending on the answers that they are going to give you, you can advise them on safe on the way to make water safe for drinking, or better way of sanitation, maybe telling them you should slash the environment, or maybe cut trees so that you prevent mosquitoes from breeding in those areas, and then that was going to reduce malaria. So a lot of things that you can explain on health promotion here, on disease prevention and health promotion. Because we look at disease prevention, there are a lot of diseases that can be prevented. Okay, so most of the time you find that statistics have shown that most of the children in rural areas, they die from preventable diseases. Diseases like malaria, okay, diseases like diarrhea, diseases like dysentery, those are preventable diseases. You can just control the way you're controlling water, the sanitation, as well as hygiene, hand washing. You teach them on hand washing. Basically, let's say look at airborne disease like cough, okay, etc. So these are some of the roles of a nurse in the well child. It's very much important you know in pediatrics as what are the roles of a nurse in the child. Looking at the roles of a nurse in the child, let's look at two major terms that are denoting to the well child, or that exist within the well child. The well child is a unit which we are going to tackle bit by bit until we finish it. It's very interesting and child-centered. Okay, so now we want to look at growth and development. So these terms can be used interchangeably in some circumstances or in some situations, but they do not mean the same. We want to look at growth and development. What differentiates growth from development? Okay, so now let's look at what is growth. Growth refers to a quantitative increase in physical size of the body or its part. Quantitative increase in physical size of the body or its parts. So let's look at major terms in this definition of growth. We are looking at quantitative. Quantitative means numbers, increase in numbers of the cells, okay, numbers of tissues, numbers of maybe blood. If the child is little, even blood is little. Increase in physical size of the body or its part. That is what we call growth. Once you just see someone's body, they're able to grow. Maybe you see their head, you see their hand, everything physically that you can see and it's growing. That's what we call growth. Of course, this is not going to give you the precise definition of growth until we compare it with development. That's when you are going to relate it. Okay? So growth can be measured objectively. Okay? So growth, we are saying that growth can be measured. You can actually get the weight of someone. You can get the height of someone. Okay? You can use both weight and height to determine the BMI, body mass index of the child. All those, that's what we mean by it can be measured objectively. So now, looking at growth definition, let's look at some of the examples of growth that we mean or denotes to growth. So we have increase in weight. Someone has gained their weight. They are growing. Increase in height or length, rather, meaning that someone is growing. Increase in head circumference. It means that someone is growing. Increase in organ size. You can't compare the size of the liver in a 72-odd person with someone who is an infant. Okay? So growth has occurred there because as the person grows, even organs grows, tissue grows. That's how it is. Growth usually occurs until early adulthood. So we are saying that growth is something that occurs continuously until the child is, or maybe until that person is in early adulthood. Early adulthood, we are talking about the ages of 21, 22. At these ages, the bone where growth occurs, the epiphyseal plate, is no longer a cartilage. It is calcified and there is no growth that can occur. So basically growth can occur until maybe early adulthood in their 21s, basically 21. Okay, 21, 22, someone would have ceased growing. They can only start the other one, which we haven't discussed. So there is time for growth and there is time for development. They can occur instantaneously, but there is specified duration and time these things can occur. So these are some of the examples of growth. I hope we are moving together. So now looking at the examples of growth and development, I think now we have more information about what growth is. Can we now try to evaluate more about development? What is development? So development refers to qualitative increase in skills, functions, and abilities of the child. So if you look at that one, it was quantitative. Quantitative deals with numbers. Okay. However, qualitative look at it doesn't look at numbers. Qualitative look at theories, knowledge, intelligence of someone. That's what qualitative looks at. Okay. So development refers to a qualitative increase in skills, functions, and ability of the child. Okay. So we mean it involves maturation of physical, mental, emotional, and social functions. If the child is growing, and then time for development starts, whereby definitely they start attaining certain skills. Okay. If they were lifting a 10 kg of meal, already they have started lifting maybe 25 kg. Okay, that is an increment in the functions, abilities of the child. They are able to think, analyze, think deeper, think for their future. Okay, at this particular time, they are no longer someone to be followed from time to time. They are able to analyze which is bad and what is good. So basically, those are abilities that we're talking about. Have you tried to grasp the difference between growth and development? I'm sure you have. In other words, we can say growth is about the physical increase of the person. As well as development, we are looking at qualitative increase in skills, mental abilities, etc., etc. Now that we've said what development is, what are some of the examples of development? What are some of the examples of development? We are looking at sitting, we are looking at standing, we are looking at walking, we are looking at talking and language use. Okay, talking and language use. We are looking at social interaction. We are also looking at emotional control. So when you look at all these things, they are not related with physical increase. It's just gaining now the skill to sit and stand and walk, okay? Having the ability to talk and use a certain language, okay? Growing mentally through social interactions, we're able to make meaningful conversation with others. Even emotional control, you start controlling your hunger. You start developing kind of love, affection within you. That's basically only development. Okay, we've talked about these two, growth and development, in a more simplified way. Now, we want to compare them. Of course, the comparison is just going to be the difference of what we have been previously talking about. So growth and development. So now we want to compare some parameters. What differentiates growth from development? Of course, we've touched some parts, but let's also derive this as summary of what we've been discussing. Growth is quantitative, meaning it deals with numbers physically, increase in the size of the liver, the head size, circumference. However, development is qualitative, whereby someone increases in skills, they are able to speak the languages. Measured in numbers. Growth is measured in numbers. You can tell that the head circumference has now reached 36 centimeters. You can tell that the weight is 2.9 kg. However, how about development? Development, you cannot measure it. You can just know it. It can be measured by the skills, abilities, of course. Okay? This child has really developed. They are even able to speak Bemba. They are even able to speak Nyanja. They are even able to communicate with others in a good way. What happens to growth? As someone grows, growth stops after maturity. The maturity we are talking about is early adulthood. In the ages of 21, 22, someone would have ceased growing. And that's one thing about growth. How about development? Someone can develop throughout their life. Someone can gain their skill throughout their life. Someone can gain wisdom throughout their life. Someone can continue attaining degrees throughout their life. That's what we mean. How about the other parameter? There is physical increase only. In growth, there is physical increase only, nothing more. How about development? We have physical, mental, emotional, as well as social increase. There are a lot of parameters when we start looking at development. So those are differences between growth and development. Please make sure that these simple things, once they come in an exam or NMCZ, you tackle them and answer them according to their severity. So those were the comparison between growth and development. Now there are specific principles under growth and development that we should note. What are some of the principles of growth and development? Or what does growth and development, what are some of the rules that growth and development obey? That's what we mean here. So basically, pediatrics, very much important. It's always simple like this when learning, but you should always think critically and study hard to understand fully. Okay, so now under rules that growth and development obeys, there are some of the people, eminent people, who contributed much to these certain principles. So this is according to Wong and Palu data. Growth and development follows certain principles. So these guys, they sat and realized to say that growth does not occur by mistake. Growth does not occur anyhow. Growth does not occur in any other way someone can think. Growth occurs unique, and they develop some principles on how growth occurs. Don't forget the name, Paru data and the home. So now let's look at these principles at these two people. developed under growth and development. So now we have one. Growth and development are continuous. Growth and development are continuous. What does this statement mean? It means that once growth starts, someone will continue growing until they are fully grown. Okay? They are fully grown. Same with development. Development continues throughout their life. Okay? So we do not them to be continuous. There is no phase in growth where someone will delay. Delay will alarm health practitioner to say that the child is not doing fine in some areas. It could be mental, it could be nutrition, or any other parameter. So it should be continuous. That was the first principle. How about the second principle? Growth and development proceed in an orderly pattern. Growth and development proceed in an orderly pattern. So what do we mean by growth and development proceed in an orderly pattern? The child starts development with the head. Okay? The head grows bigger, and then other things can start growing. Even the child development starts with the brain. It's the brain which first develops before any other thing. Okay? The brain should first develop before the child can learn how to walk. Okay? The brain should first develop before the child can even move hands. So that's what we mean by development and growth proceeds in an orderly manner. Okay? There is no way a child learns to walk before their brain can develop. 3 is saying development follows a cephalocaudal pattern. Cephalocaudal pattern. And 4 is saying development follows a proximal distal pattern. So I want to demonstrate these two. I want to demonstrate this, the third one and the fourth one in the next slide. For now, let's look at point number 5. What is point number 5? These two, don't worry. There is a slide specifically to describe, to explain more about point 3 and 4. How about point 5? Point 5 is saying the rate of growth and development varies. Rate of development and growth varies. Where does it vary? It varies in children, in adulthood. People with condition, diseases, it varies. You cannot compare the growth rate of an infant with someone who is 19. It's totally different. So that's what we mean, rate of growth and development varies. Now let's explore more about 3 and 4. It's saying development follows a cephalocaudal pattern, and the fourth one is saying development follows a proximal distal pattern. So let's look at these two. We have the proximal distal pattern and the cephalocaudal pattern. So what's the cephalocaudal pattern? We are saying that growth starts first. As you can see the arrow here, it starts first with the head. Okay? It starts with the head and it starts moving downwards. That's what we mean. Starts from upwards going downwards. What do we mean? We mean the child should first learn how to control their head before they can start moving their hands. Okay? And before they can even walk. That's how it is. If the child is born today, their development is going to occur in this order. Cephalocaudal. What are you going to notice? You are going to notice that the child start controlling their head, start moving, then they start opening their eyes. After starting opening their eyes, then they will start moving their hands. Start moving their hands, okay? With their hands, maybe they will start grabbing some things. They will grab a pen, they will grab a what, they will touch this and this. and then from there they will start sitting. After sitting, that's when now they are going to start use of their legs. Maybe they will start leaning on objects so that they can stand. From standing, then they will start walking. Have you seen the cephalocauda? What we mean? So this is how development occurs, from head to toe, or from upwards downwards. That's what we mean. How about the proximal distal? Proximal distal, we are saying that growth starts from the midline. Okay, growth starts from the midline. Okay, so what do we mean by growth starting from the midline? A child should first learn to control their trunk. We mean their chest, their body. Okay, after controlling their body, that's when they can move to the hand. You see the child waving the entire hand at someone. They will start waving the entire hand at someone before they can even start picking things, before they can even start picking pens, picking sand or a soil. They will need first to move the entire hand. So that's what we mean by cephalocaudal and proximal distal. So it always starts from head to toe, development and growth, and then it also moves from the midline to the distal. Okay, growth always starts from the midline going this side. That's what we mean by these 2 points. Now we've looked at all the 5 principles of growth and development. Please, if you feel like you haven't understood any of the principles, just drop it in the comment section. I'm going to clarify and answer that particular question. Now we've looked at the principles of growth and development. Let's proceed to looking at factors that influence growth and development. Of course, these are obvious factors that influence growth and development. The first factor is heredity. What you inherit from parents. If the parents are giants, if the parents are short, if the parents are dwarfs, if the parents are dark, everything. So growth and development are inherited from parents. They have a tendency of moving from family to family. Nutrition, the kind of food you give to the child determine their growth and development. Okay? Environment. If the environment is supportive enough, let's say the environment is free from diseases, the environment is free from other conditions, the child is not contaminated with food, okay, that is a supportive environment. Health and illness. If the child is coping well, is not usually ill for a long period of time, if illness compromises health, the child is more likely not to grow well. Socioeconomic status. Socioeconomic status determines, looking at the financial status of the family members. So it is starting with the financial and then affecting the social. Because if you don't have money, you can't buy nice food, you can't buy nice clothes. All that is going to affect a lot of things at that particular time. So socioeconomic status of someone is going to influence their growth and development. If they're eating nice food, if they're healthy, if they're psychologically okay, if they're mentally fine, if they are not really suffering, they are going to have normal growth and development. Family and parental care. The children need to be shown love, care, and attention. Let them play in the environment that is going to support their growth and development. We also have emotional and psychological factors. Okay, so now when you look at the emotional and psychological factors, we are looking at the fact that children should be mentally stable. They should not be abused. Okay, they should not be abused at all costs. They should not be insulted anyhow. They should not be beaten. All that is going to affect their moods, and growth is going to be stunted. Those are some of the factors that influence growth and development. Now, let's look at importance of studying growth and development in nursing. Why is it important to study growth and development? It helps understanding growth and development. Understanding growth and development help nurses to identify normal and abnormal patterns. You look at the child parameters like weight and height, they are going to tell you if the child is really growing well or not. Provide age-appropriate nursing care. Okay, so now looking at growth and development, we'll also looking at because care, it depends on the care that you are providing. If growth and development is monitored and known, you are going to give the allied medication, you are going to give the right care to the right appropriate age of the child. Educate parents effectively so that if you know the normal and the abnormal. Let's say the child comes to the hospital and then they look malnourished, then you are going to advise them on proper nutrition. Okay, promote optimal child health. Promoting optimal child health is through treatment of conditions and ailments that the child might be suffering from, giving them, let's say, immunization, offering health care that is accessible, etc., etc. And in summary, we say that a well child is a health in all aspects of life. Okay, in all aspects of life, the well child definition should be taken holistically, not looking only at the mental, physical, should all look at all the factors. Growth is physical increase. Development is functional improvement. Should differentiate that. Growth and development follow predictable patterns. You can denote, you can see growth and development. Many factors influencing a child's growth and development, we have looked at them: nutrition, genetics, etc., etc. And you should also know that nurses play a critical role in monitoring and promoting child health through health promotion and other, let's say, caregiving, etc., etc. Thank you very much for watching this tutorial. I hope you enjoyed it, and stay tuned for the next topic under unit of the well child. Thank you very much.